Hello, everyone out there. Welcome. My wife and I, proud forever business owners, will be making an attempt on why high blood pressure. And we'll be looking at some of our amazing products that can help to prevent such an ailment. We've already started before, but we had an issue with our camera. And so we had to stop to rearrange it so that you can get a clearer view. Now, the question is, what is hypertension? What is hypertension? And what are we supposed to be doing to prevent it ever happening to us? Now, high blood pressure is a measurement of the force at which blood is pumped around the body. And now it depends on two factors: how forcefully the heart pumps blood and how narrowed or relaxed the arteries are. Blood pressure is always measured using two numbers. The first figure is the systolic blood pressure, the maximum pressure in the arteries when the heart contracts, beats, and pushes blood out into the body. The second figure is the diastolic blood pressure. This is the minimum pressure in the arteries between the beats when the heart relaxes to fill with blood. The systolic pressure is always listed first. Then the diastolic pressure. A typical normal blood pressure reading would be between 110 and 120 over 70 or 80. If either of the numbers is higher than normal, that individual have high blood pressure. Now, if your blood pressure on consecutive measurement is in the category of 140/90, 140 over 90, you will require medical attention very quickly. This may be lifestyle changes or some medical attention or treatment. If you have diabetes or suffer from kidney problems or have experienced either a heart attack or a stroke, your blood pressure should be not above 130 over 80. Now, in the majority of people, the cause of high blood pressure is unknown. And this is known as primary high blood pressure. In others, there is a reason for the high blood pressure. And this may be due to the medicine that you give to your body from time to time for medical illnesses. Okay, this drug could lead to the narrowing of the blood vessels, and it could be very dangerous to wellness. And this is called the secondary high blood pressure. Now, high blood pressure has been called the silent killer, as it is responsible for increasing your risk of heart attack, strokes, and heart failure. About 44.8 million people are affected by this condition in Nigeria alone. Now, heart attack. Arteries carry oxygen in the blood to the heart muscle. If the heart is under pressure and the arteries become narrowed, blood is unable to flow easily. It causes chest pain, known as angina. If the flow of blood is blocked, the result can be a heart attack. When it comes to stroke, the high blood pressure can cause the small blood vessels in the brain to bleed, or indeed cause a clot to block off an area to the brain, completely causing a major stroke. That area that has been blocked completely will be deprived of flow of blood, and that area or that particular organ could even die. Now, in the eyes, high blood pressure can cause the tiny vessels in the eyes to bleed, leading to weakened vision, and if untreated, can lead to blindness. But what about the kidneys? If the kidneys are subjected to high blood pressure, the vessels adjoining it becomes narrow. Consequently, less is being filtered. Waste products now will build up, and if left unattended to, could lead to or will lead to kidney damage. Now, what are the symptoms of high blood pressure? The bottom line is there aren't any symptoms unless your blood pressure is very severe, in which case you may suffer from headache, shortness of breath, dizziness, and visual disturbances, cloudy vision. Often it is found that you may have high blood pressure on a routine check at the doctor's. You need to go to see your doctor to help you out. Medical check is compulsory for you to be able to know whether you are having high blood pressure or not. Because sometimes there could just be no signs at all. That is why the check is very, very important. Now, what makes high blood pressure worse? If you have members of your family who already suffer from high blood pressure, there is an increased risk, because it could run in a family. So if you notice that the family members are having it, then you must have to go to check yourself. You don't need to wait until you start experiencing the crisis. Now, if you are overweight, you smoke, and you don't involve in exercise, and you have a high level of alcohol intake, you are increasing your risk with each of those. Other illnesses like diabetes and kidney disease can also be a factor to high blood pressure. Now, what can one do about checkmating high blood pressure? What can we do? Now, looking after you seems easy to say, and yet there are some quite easy ways of helping ourselves without medications to actually improve our lifestyle and our blood pressure. Number one is, if you're on the big side, you try as much as possible to lose weight. Losing of weight will help you tremendously. Large portions are a big problem with our eating habit. Large portion, you want to eat everything, Eating less and healthier food can noticeably improve energy levels, and we encourage us to look to supplement. It will help. High quality nutritional supplement will help to detoxify the body of all unhealthy fat deposit in the body. Then, taking regular exercise is equally very important. Short bursts of exercise of about 30 minutes a day can dramatically improve your fitness levels. Some people will say, I don't have the time to go to exercise, but exercise is compulsory. If you want your body to be strong, if you want to enjoy vibrant health, then you must have to exercise the body. If your body is being exercised, all of the cells will be celebrating. Then eating well, eating at least 5 portions of fruit or vegetables every day will equally help. It will help. It can have a very beneficial effect on your overall health. And like I said initially, food supplements, especially high quality nutritional supplement, as we're having it on the forever shelf. Then you must have to reduce the intake of salt. Salt. The food is placed before you, and you got for yourself the white salt and you put it into the food. It is not necessary. Not adding salt to the food and using herbs to flavor is an option to consider, as well as many other reduced salt products that we're having around us today. Those wonderful spices, organically put together spices, would be ideal instead of too much of salt. Then you must stop smoking. It is true that it is not easy to stop an old habit, but then when you look at it that your life's at risk, then of course you just have to think about putting an end to smoking. The question is, what actually do you even benefit from smoking? On the pack of every cigarette, we have it clearly stated that cigarette smokers are liable to die young. So what could be the relationship between you and cigarettes? Death. Then limiting your alcohol intake. Alcohol intake dehydrates the body and deprives the cell of vital nutrients. So the advice for us all is to limit or stop it completely. Alcohol is no food. It does not give to the body what the body needs. What nutrient does alcohol contain that can be of any benefit to us? So it's advisable to put an end to it. Now, what happens if blood pressure is too low? I just talked about high blood pressure. Now I want to talk about low blood pressure. Low blood pressure is usually to be worried about. You must worry about it when it is sudden and when accompanied with other symptoms such as dizziness. Sometimes you just experience some dizziness and you say, "Oh, my dizzy meal." You don't just conclude like that. If you are experiencing constant dizziness, there's a problem. Fainting, difficulty with vision, you're experiencing cloudy vision, there's a problem. You must go to check yourself. The health service provider, they are there. Then, rapid breathing is a problem. Pale and clammy skin or exhaustion, all of these are some of the signs. Severely low blood pressure can be potentially very serious, as lack of circulating oxygen to vital organs can be life-threatening. So whether it is hypo or hyper, it is dangerous. Very dangerous. Now, what could be some of these amazing products that can help us to checkmate hypertension and help to take care of it completely? From the Forever Chef, we can identify the aloe vera gel, garlic thyme, Arctic Sea Omega 3, Ginkgo Plus, A-Beta Care, ginger, absorbent C, and even sometimes we advise for the C9 pack. Okay, now what can we, some of the products can we share with us out there?
Okay, we have the aloe vera gel.
Okay,
It's a natural healer.
aloe vera gel.
Yes, it balances the immune system, and you can take it 60 ml 3 times daily. You take a little shot in the morning, and then shot in the afternoon, and then in the evening. It helps to balance your immune system.
Okay, what other products can we identify with
Yes,
helping to arrest high blood pressure?
we have the Arctic Sea Omega 3.
Arctic Sea Omega 3.
That is Arctic Sea Omega 3. It prevents and dissolves blood clots. It reduces cholesterol. You take it 2 capsules 3 times daily.
Okay, now what other one can we identify with the Forever Shelf?
We have the garlic thyme.
Garlic thyme. Okay, that's the garlic thyme. The garlic thyme actually improves circulation and it strengthens the capillary walls. It can also help to prevent and dissolve blood clotting. It's a powerful antioxidant. It's a natural discongestant, and it helps to reduce cholesterol, bad cholesterol. It also contains allicin, a powerful bacteria-fighting agent. Just 2 capsules 3 times daily. Okay? And then we can equally talk about the A-Beta Care. A-Beta Care, this also is a powerful antioxidant, anticoagulant. It helps to dilate the blood vessels, improve circulation. It helps also to strengthen the capillary wall. It helps to prevent and dissolve blood clots. So, all you need on this, 1, 2, 3 capsules daily. Okay? So what other product can we talk about right away is the ginger. Ginger can equally help. Okay? The ginger is not right here with us. The ginger can help to prevent nervousness or stress. It's a natural antidepressant, the forever ginger, and it helps to increase stamina and endurance. So it's very helpful for those suffering from weak libido. Then we have also the absorbent C. Okay?
There's a power. The absorbent C is a powerful antioxidant. It strengthens the immune system. You take it 1 tablet 3 times daily.
Now, all of these very amazing products are meant to help us maintain vibrant health. Okay? Now, it is advisable for every one of us out there to go get yours. Look out for any of the forever business owners around you, and then
You can message us.
ask much more about it, and you can equally message us,
Yes.
okay, through our social links. Thanks for listening. Remain blessed.
Have a good night rest.